We're also taking additional action today to further protect our healthcare workers and our healthcare providers. Federal and state law provides certain protections for healthcare workers and especially volunteers against lawsuits and civil liability. But during this pandemic, we're in unprecedented times where our providers may be forced to make difficult choices, and we're asking them to operate in conditions that they've never planned for. We need to make sure that fear of getting sued doesn't prevent them from being able to do what they need to do to treat as many people as possible. First, I'm issuing a directive that will maximize protections for healthcare workers and healthcare facilities under the Federal Public Readiness and Emergency Preparedness Act, or the PrEP Act. The Federal PrEP Act on its own provides significant protections for our healthcare workers. The directive that I'm issuing will ensure that healthcare workers and facilities that distribute and administer testing, drugs, and medical devices for this for the diagnosis and treatment of COVID-19 are protected from lawsuits and liability to the maximum extent possible under the PrEP Act. But the PrEP Act does not cover all the situations our healthcare workforce may encounter and needs to be protected from during this particular pandemic. Because it's limited in some ways to certain aspects of the COVID-19 response, it doesn't cover everything we believe needs to be covered. That's why we worked with the Attorney General's office, with many folks in the healthcare advocacy and ethical community, with hospitals and the Mass Medical Society, to create additional protections in the bill that we filed earlier today. The legislation would protect healthcare professionals, including doctors, nurses, and EMTs, as well as healthcare facilities, from liability and lawsuits when the care they provide is impacted by the COVID-19 emergency. It would also provide liability protections for the organizations that have generously made their facilities available for the Commonwealth and for many of our providers to use in response to this pandemic. We speak with leaders and doctors from Massachusetts hospitals and healthcare organizations just about every morning, and they are stepping up in a big way during this crisis. And this bill will make sure that they are free to do their jobs the best they can in this unprecedented situation. And again, I want to thank the Attorney General, Maureen Healy, and her team for their help in crafting this legislation, and we urge the legislature to move quickly on this bill.